As we approach the end of the fiscal year, we're doing a lot of housekeeping. Transfers of note, item number 33. Just to let you know, I mean, we're just having a tremendous amount of prisoner medical expense this year. So we're having to move. We just had some just horrendous expenses, and these are after some negotiated price concessions by some of the providers. So I would even hate to venture a guess where we'd be looking at had we not been able to secure those. Item 35, and this transfer is just to get us through this month. I mean, we're probably going to be coming back next month depending on what's going on there. Item number 35 was the scavenging that was done, I guess, to acquire the hovercraft. Most of that money was taken out of different accounts in order to get that paid for. And item number 39 is just we're continuing to pay for the outside services and some new servers for IT purposes is what we've got there. With this month, we pay off the one bill that we received from Johnson County for their time. So we will owe Johnson County nothing after this. Yes, sir.
Go ahead.
I have a motion by Larry for items 27 through 41 on the money moves. Do I have a second?
Second.
I have a second by Kenneth. Any further discussion, John?
Brian, on Sheriff's Department,
Yes, sir.
is there any way that we can get funding from the state for reimbursement on some of this?
I wish there were.
We're trying every aspect, John, even on the food. I hope next year there's more.
You know, the food is really kind of I'm okay on the food primarily simply because we do receive reimbursement from Hood County for their prisoners. These medical expenses are all ours. I mean, this is not paying for any Hood County inmates. This is just Somervell County. So, you know, that's the contract we have with Hood County. Is Hood County pays for the medical and dental expenses of their inmates, but we have to pay ours. We've actually had, this year, we've had a couple of surgeries that we've had to pay. It's just been horrendous, and it's even more so when you know, obviously because of HIPAA statutes, I can't tell you, but I can tell you that it's less than 5 inmates that are the majority of this.
Medical, medication, and dental.
This would, I don't know whether it falls under Houston Health or not. Is anybody trying?
It does and it doesn't. Indigent Health gives us the ability to negotiate some rates, which we did use. Remember when we were in the indigent health business, we actually budgeted for it and collected tax money for it. So it was still our expense.
Right.
Same here. So indigent health, the only ability it does give us is it gives us some negotiating room to not pay the rack rates, you know, that somebody would charge. And that's why I tell you is that this number is with those negotiated rates. And had we not been able to secure those, and those were the results of some meetings that the judge and I attended, and you know, just tried to get some better negotiating room and pitting some providers against each other, we would really be up the creek.
We haven't given up yet, but like Brian said, we've attended at least 2 meetings, and Brian's taken out on his own with 2 or 3 of the providers.
We're only responsible for in-county inmates?
Yes, sir.
And this 27,900 is additional from what we already
Yes, sir.
been doing.
Yes, sir. It's, you know, when they come into the jail, you know, it's time to get all your all of a sudden you've got all this medical issues that you want to get fixed. And, yeah, It's a costly thing. Of course, you know, I'm not so politically correct. You know, when they say their tooth's hurting, I say, go pull it. You know, they don't need teeth. We'll feed them Jell-O. And, you know, the jailers and the chief deputy has to remind me, well, we've got some state rules we got to follow. But
That wasn't received well, was it?
it was not received well. But, you know,
You tried.
I did. But we have the state mandates that we have to take care of these prisoners. So
Unfunded mandates.
unfunded mandates. And, you know, we do what we can with our local judge. You know, if somebody really has a real issue, we might be able to work out a time served and get them gone. But obviously, some of these inmates that are being held on, you know, state charges, waiting trial, there's not a whole lot we can do.
Yeah. It's,
So, I'm sorry, but, yeah.
no, it's been quite a discussion.
Is it correct I saw one charge for over $8,000?
Yes, sir, that is correct. That was for a surgery. And thankfully, for anybody who's had a surgery knows that $8,000 is actually pretty good. You know, the number actually on that particular one started out over 30, and we were paying 8.
Yeah, I got a bill for $115,000.
That's why we're not gonna arrest
Because
you.
our insurance doesn't, not getting the proper information from the hospital. I'm gonna hit Larry up for a moment.
Or just get arrested.
Okay, moving on. I have a motion by Larry and a second by Kenneth to pay items, I believe it was 27 through 41. Any further discussion or questions? All in favor of said motion? It's 5 for, 0 against.